for staying with us. You know, more than 1 in 7 adults are estimated to have chronic kidney disease, and about 90% of them don't even know they have it. There's a range of causes and treatments for said kidney disease.
Joining us to talk about kidney care and how to get the treatment you need are Dr. Puneet Bedi, Dr. Sofia Kostelanetz from One Brooklyn Health, and Dr. Nicole Ali from NYU Langone Health. Welcome, good to have you here. We got the whole doctor panel, all the doctors.
The panel is here.
If you can't get a doctor's appointment, it's our fault because we have them all here.
That's right. Dr. Bedi, I want to know, there's some surprising numbers. How is it that 90% of people with chronic kidney disease don't even know they have it?
Thank you for this opportunity. Chronic kidney disease is very common. 1 in 7 Americans have it. But the burden of the disease is even greater in the communities that we serve at One Brooklyn Health. Medicare patients, Medicare recipients, 1 in 4 or higher have the chronic kidney disease, and most of them stay undiagnosed. And the reason is it's a silent disease. It doesn't cause any symptoms. And when it does, it's very non-specific, like nausea or itchy skin. And they appear very late in the course of the disease. And that's why we emphasize the need for annual physicals and routine blood work to diagnose this condition early, especially in patients who are at high risk, those with blood pressure and diabetes.
Interesting. Dr. Ali, there's a partnership between NYU and One Brooklyn Health. Can you tell me a little bit about that?
Yes, so recognizing the gap in care for kidney disease and transplantation, especially that exists right here in New York, in Brooklyn, we partnered with One Brooklyn Health and their team to really bring better access to kidney transplant services in Brooklyn. One of the big barriers for transplant access is something as simple as transportation. The distance from Brooklyn to Manhattan is not really that far, but getting from one place to the next can be hard. And so with us and the trusted team at One Brooklyn Health, patients are able to better access transplant care.
That's important. It's the last thing you probably think about, getting from point A to point B, but also crucial. Dr. Kostelanetz, what are the goals of this partnership?
The primary goal of this partnership is really to work to address transplant equity. So what does it look like for our community in Central and East Brooklyn to get the best chance at getting kidney transplant access if they need it? So both in terms of talking about transportation and that geographic barrier that exists and can be very common, and knowing the long-term trusted partnerships that our community, our patients have with community-based organizations, with our hospital, with their physicians, being able to bring that together with the specialty expertise of NYU to give our patients the best chance at those transplants.
And speaking of transplants, Dr. Bedi and Dr. Ali, what should folks know about the kidney transplant process?
So a kidney transplant is a surgical process. It's taking an organ from a donor and putting it into someone who has kidney disease, allowing them to have better kidney function. This allows them to either avoid dialysis or come off dialysis, and gives them back quality of life. In order to be a transplant candidate, we do put patients through an amount of workup to make sure they're strong enough for the surgery and that they can handle the medications that are needed for the transplant to work well. I think for patients, they really want to look at how they can get transplanted quickly, because the longer they stay with kidney disease, the longer they stay on dialysis, the worse their health is. And that's one of the great things about partnering with One Brooklyn Health. With NYU, we are one of the fastest transplant programs in the area and have one of the best outcomes in the country. So we really look forward to being able to get patients off dialysis and back to their life.
Dr. Kostelanetz, can you elaborate a little bit on that? Because it sounds like it's a pretty special program.
Yes, so we're so excited to be able to bring the expertise of both institutions together, and then also have the support of social workers that we need, of financial consultations, of a navigator to help patients, support them through their care, connect them with the services they'll need in the community to be able to be in their best self, their best health, to be able to go through this process. So really excited to be able to launch this program.
What are some things that our average everyday viewer could do in terms of diet, in terms of exercise, to just improve their kidney health right now today? That's for anybody. Give me some advice. Save me a copay.
I think, for one thing is blood pressure monitors are pretty readily available. You can buy them at CVS, Walgreens, Walmart, anywhere. And checking your blood pressure. If you see your blood pressure is high, you should see your primary care doctor and figure out why. That's usually a sign of kidney disease or cardiac disease, something else going on. And that can be a very early intervention sign that you need to delve further and figure out what's going on.
Exactly. I think just living a healthy lifestyle, knowing your numbers. So have your annual physicals, know your numbers, do the routine blood work. That should really help diagnose this condition early so that you can plan the interventions that are necessary.
Great information. Thank you all for joining us today.
Thank you so much for being here
Appreciate
today.
it.
To learn more about kidney disease and the partnership between One Brooklyn Health and NYU, scan the QR code on your screen or visit pix11.com and click on the Pix Partners tab.